Not so long since at Leicestershire Partnership NHS Trust, we noticed we were receiving more and more feedback from young people about the way we communicate. They wanted to get in touch in more timely, more modern ways, rather than, say, waiting to come to a weekly clinic every time. And our nurses were keen to respond, but they felt they didn't really have the tools to do the job, both in terms of the technology and in terms of robust guidance that was set up for a smartphone world. That's how the school nurse messaging service came about, to support our staff and our service users. And here's what some people are saying about it.
It allows us to express ourselves in a way that we couldn't express to our friends, and to know that it's confidential makes me open up to other people besides my other friends.
Because sometimes you have things that are so embarrassing that you can't talk about. So if you send a message, then the nurse already knows what you're going to talk about, and then we can just think of ways to get over that and just help. So it's really useful.
You can feel judged by talking to someone face to face. So I think if you can text them, it's like they don't actually know who you are.
So the app, it's got a password and stuff, so it's very private, and you can talk about something that you might not want to talk about face to face necessarily.
There are some situations where you don't necessarily have to see a young person, and they'll come to you for information about various issues which you could have given them the information without actually seeing them. So from that point of view, there are definitely situations where the service is saving us time. We are not having to go over to the college to see young people, because we're actually giving them the information much quicker.
I've found that it's been easier to answer the questions. You've got time to think about it. You've also got time to speak to other school nurses. You could also talk to other agencies if you felt you needed to before you answer the question. So you're giving them probably a better service by having that time as well.
Previously, we had a system where we were giving out our text messaging, numbers for text messaging, but it wasn't auditable, it wasn't standard, we weren't convinced it was safe. This system is not only fulfilling national expectations that we use social media in a much better way, but also it's going along with what the young people want. Young people want us to be socially acceptable to them using social media.
So something like that you've been piloting here in Leicester is absolutely groundbreaking and really, really fantastic. There isn't anything else that we've seen out there that has got the evidence base behind it and is so robust as what you've developed here. It's been a 9-month pilot, but actually what you've achieved in that time is really sustainable and will actually lead on to greater things. So we're quite excited about this.
And on digital radio, this is Capital News.
More teenage boys are asking for health advice in Leicester. Now they can text their school nurse instead of having to have a one-on-one meeting.
Hamza, and I'm 15. You can ask her anything. Sometimes you just need advice from an older.
Say now that I'm 16, it might be about the problems that you've already talked about if you see the nurse yourself, or if it's anything going on at school or problems at home.
Students at Judge Meadow Community College are piloting the NHS messaging service. Wendy Nicholson is from the Department of Health.
It's about relationships, friendships, and also their general health and well-being. So it's such a wide range of issues, and this gives them confidence to ask some of those difficult questions.